I'm Wali Azim. I'm with CDW Healthcare, and I will be moderating today's webinar. Wanted to take the time to thank everybody and welcome you all to today's webinar, Beyond Patient Portal, Leading Practices in Collaborative Care. Today's discussion will be led by Dr. Bill Fera and Natasha Sokolovich, and is brought to you by CDW Healthcare, our partner Cisco, and Ernst & Young. Before we get started, I want to remind everybody that we will be live tweeting during today's webinar. To join the conversation, please use the hashtag CDWHC. A little bit about our presenters today. Dr. Bill Fera, MD, is a family medicine physician and the Chief Medical Officer of Ernst & Young's Advisory Healthcare Practice. With a personal interest in healthcare quality improvement, he has more than a decade of clinical and information technology leadership experience at academic, community, and ambulatory medical centers prior to joining Ernst & Young. Natasha Sokolovich is currently the Executive Director, Telehealth, and Senior Director, Affiliated Physician Services at UPMC, with the responsibility for the strategic growth and operations across both programs. The UPMC health system, located in Pittsburgh, Pennsylvania, is an $11 billion global health and integrated clinical delivery system with over 60,000 employees, 21 hospitals, and over 400 doctors' offices and outpatient sites. UPMC also maintains its own health insurance service division with over 2.4 million members. Natasha's education includes a dual major, Bachelor of Science, magna cum laude degree from the University of Pittsburgh in Business and Psychology, as well as a Master's in Healthcare Policy and Management from Carnegie Mellon University, H. John Heinz III College. Natasha also holds a Juris Doctorate degree from the University of Pittsburgh School of Law and is licensed to practice law in Pennsylvania. Natasha is also fluent in Serbo-Croatian. With that said, I will pass over to our first presenter, Dr. Bill Fera.
Thanks very much, Wally. I'll just start with today's learning objectives. And upon completion of this webinar, participants should be able to do the following. 1, discuss the current landscape of patients engaging collaboratively in their health and wellness. Number 2, identify the various technologies that enable collaborative care between patients and clinicians. And number 3, describe organizations who have achieved leading practices in establishing collaborative care initiatives. So with that, we'll just move into what may or may not be a simple definition of collaborative care. So when we talk to various organizations and clients about collaborative care, everyone has a slightly different definition. So for the purpose of today's talk, we'll use the Agency for Healthcare Research and Quality's definition, which defines collaborative care as deliberately organizing patient care activities and sharing information among all of the participants concerned with the patient's care to achieve safer and more effective care. This means that the patient's needs and preferences are known ahead of time and communicated at the right time to the right people, and that this information is used to provide safe, appropriate, and effective care to the patient. So that's a long definition. Maybe more simply defined, we'll say collaborative care is working with patients to improve their overall health status using approaches that are personalized and based on individual needs. And I think if we just think about it a little bit further, what we're really going to focus on today is the patient. A lot of times when people talk about collaborative care, they focus on the care team and an interdisciplinary care team, extenders, health coaches, and all of the new agents that are involved with patients' care, but probably left out of the conversation far too often is the patient themselves. An engaged patient obviously is the key component to a collaborative care model. So we'll focus on that. Then appropriately, collaborative care will achieve the triple aim of reduced cost with an engaged and engaged patient at a superior experience yielding reduced costs. So with that, I'll hand it over to Natasha to talk a little bit more about the need for collaborative care.
Thank you, Bill. So there's a clear need for collaborative care. If we look at where the spending, the bulk of the spending occurs versus where care actually occurs across the continuum. There was a recent article published by the Healthcare Financial Management Association earlier this summer that showed that while only about 16 days for a patient occurs in the hospital, that relates to 34% of the overall healthcare spend, whereas the other 300 days that they're involved in care and management of various chronic diseases, there is greater than, less than 18% of the spend. So a disproportionate number of resources is spent on inpatient versus focusing on the patient in the home where they're actually managing their overall health and well-being. So if you look at the effective collaborative care model, it has to migrate from the hospital and actually look at patients as individuals to better manage and integrate care into their lives. Most healthcare decisions aren't made within the hospital, they're actually made at home. So it just really is logical that we do a better job focusing on that overall collaborative care approach to overall health care and well-being.
Thanks, Natasha. So as we've been saying, integral to collaborative care is a patient engagement. And collaborative care really begins by, one, understanding the patient needs and preferences, and two, engaging patients themselves in their care actively. And there is a lot of data out there that supports the fact that patient engagement has real benefits to both patients and providers. And we see that engaged patients have better outcomes. And studies have shown that disengaged consumers are twice more likely to experience a medical error than those that are actively engaged with their care. Disengaged consumers are also more likely to suffer a health consequence due to poor communication. 49% more likely if they're disengaged versus only 13% that are engaged. So those that are engaged can help mediate the communication among providers versus those that are disengaged may miss those handoffs, or if there's an error in their medical record that may not be completed, that may not be caught, So for example, 89% of patients request chart changes when they review their health records themselves. So an engaged patient becomes another source of quality information and helps to reduce medical errors. They also tend to help reduce costs. A fully informed patient will choose or tends to choose less expensive options. And finally, a recent study that looked at readmissions showed that patients readmitted to the hospital within 30 days of discharge were only half of those for engaged patients versus disengaged patients. So in other words, 13% of engaged patients were admitted within 30 days versus almost 30% of those that were not engaged. So Natasha, do you want to talk a bit about how patients are ready to be engaged?
Yeah, so clearly the data around the support that patients are ready to be engaged. If we look at how most of us approach everyday activities, from online shopping to mobile and online banking to making reservations using the internet at our convenience when we want to do it, the data is very supportive that consumers are ready to have the same access to online virtual options in their healthcare experience. And if we look at the percentages, 65% of consumers want digital access to health records. So digital access is key. And while many providers are providing it via portals, there's additional access that the patients are looking for. So when patients were asked about access to health information, 72% of the patients are internet users, and they actually said that they looked up health information online. 60% of consumers say that cost and value pricing transparency is important to them, and that understanding the cost of their overall health care would have informed their provider choice. And this becomes more and more important as the reimbursement shift is a bigger factor and consumers have more out-of-pocket expenses that they have to pay when they decide to engage a provider or decide that they're going to choose to have an intervention. So 72% of consumers are more likely to choose a provider that offers convenient multi-channel services, and 54% say that they would like to book appointments online. 52% are smartphone users have looked up health information online or have used one of the health apps that are available. And 62% of consumers want access to an online cost estimator. Again, the big shift here is that more and more consumers have a bigger financial stake in the game with out-of-pocket expenses. So price transparency becomes something that consumers expect. And if we look at the shift of what we anticipate is going to happen in healthcare, we expect that consumers are going to look and shop for healthcare just as they do for televisions or any other online retail purchase. So just move on to the next slide. In combination with the industry forces, collaborative care is truly inevitable. As I've already said, industry forces are shifting the reimbursement metric. There's major shifts in regulation. Affordable Care Act has required coverage for populations that historically haven't had access to preventative care, and we need to be able to manage those populations better and in a less costly manner. So there's a lot of pressure on affordability and truly affordable care. As I've already talked about, increased demand for price transparency. So as providers, I think there's an understanding that we have to be better at recognizing what the overall cost of care is and actually sharing that with consumers. There's also changes in healthcare financing, as well as the expanding availability of data, which actually should help providers to be better at providing more focused and collaborative care across the continuum. If we look at the consumer forces, the higher level of financial risk with more out-of-pocket expenses, there's an expectation of convenience as consumers start to recognize that there are mobile applications in healthcare. We see the uptake of those increasing, and we expect that there's going to be more of a demand for that type of convenience, including being able to schedule appointments when the patient would like to see the provider versus being kind of pinched into a slot. There's also a mainstream interest in quantified self, or a better understanding in the overall health and well-being that individuals have access to with online tools and educational materials that are available. There's growing access to health data, and consumers have an expectation that they are able to view their data on demand and be able to transport that data. And there's a widespread adoption of wearable devices. And so the goal would be to really be able to integrate those wearables into that overall collaborative care model. And so, Bill, if you could talk a little bit about how collaborative care is globally viewed as a promising solution, that would be great.
Sure, Natasha. So maybe not surprisingly, telehealth is not, and collaborative care is not just a U.S.-based phenomenon. And in fact, in many areas of the world where there's a single payer system or more widespread risk-sharing models, we see bigger uptake of collaborative care models and telehealth models. But if we look at the European Commission, for example, a recent paper there estimates that if they could unlock the full potential of mobile health and get full engagement of patients, there could be a potential of 99 billion euros in savings in healthcare costs. In Africa, they're using relatively more simple technologies like SMS to communicate effectively with patients, to monitor for outbreaks of diseases in real time with real-time surveillance mechanisms, test for medication adherence through virtual visits and through patients uploading information themselves, and also allowing and providing quizzes through mobile devices to assess awareness and education in real time again of patients. So all of those things are ongoing and show great promise in Africa and more remote areas as well. And then in the U.S., there's been a number of entrants into this space and a number of applications and startup companies that are really trying to unlock patient engagement in a meaningful way. The U.S. government, in the meantime, has through the NIH has recently issued a grant to really study wireless and mobile health research over the next 5 years. It's really trying to use those wearables and patient information to gain a greater understanding of disease outbreak, behavioral modification, and impact on disease modulation.
Thanks, Bill. So the good news is that there's no shortage of technology, and in fact, the technology definitely exists to support services that would allow providers and patients to have a collaborative care experience. If we look at some of the popular technologies that most people are aware of, there's health and wellness apps that are easily downloadable on mobile devices or smartphones. There are extensive providers that now offer patient health portals. There's web-based voice, video, and data for synchronous and asynchronous telemedicine visits. There are wearables and portable biometric devices that measure everything from blood pressure to heart monitoring and even EKG reads. There are web-based care plans and consolidated patient data that's available, and they offer the full functionality that is necessary in order to have a collaborative care program. And that includes transition of care, support care planning, allowing patients to adhere to their medication and monitoring of medication compliance, remote patient monitoring, which allows clinical data capture, clinical data alerts, and a timely intervention to hopefully prevent unnecessary hospital admissions or readmissions. There's reminders, SMS, text messaging, and information exchange that's able to be offered via secure portals. And there's online education and awareness, as well as awareness and education that's pushed out by many providers and many sources that can be used. So Bill, can you let us know a little bit about how the health apps are growing in the technological market?
Yes, as you said, Natasha, I mean, there is a proliferation of these technologies, and corporations in Silicon Valley is definitely taking notice of this trend. So if we look at the fact that health and fitness was the fastest growing app category in 2014, to the extent that 100,000 apps dedicated to health were deployed in that year, which doubled over the last 2 years. We had a $4 billion global health and fitness mobile app market in 2014. And our own research at EY indicates that 35% of providers are starting to use applications and websites for customized disease management of their patients. So not only is there a great output, but there's starting to be uptake of these applications and these resources both on the patient side as well as the provider side. And certainly there's interest in managing health and wellness. The effectiveness of these apps as standalone tools remains to be seen. So really the issue is, how do we integrate these applications into a holistic picture for patients so that we are able to use all of the information that is able to be brought to bear in an integrated fashion. Getting this information in a one-off manner certainly isn't always the best way to proceed, and obviously is usually ineffective as standalone data points. I think, as we'll talk about a little bit later, it's also very important to understand the sophistication of these applications. So there are those that are building these technologies that are getting FDA approvals. Some are starting in Europe and moving to the US as they get FDA approvals. Some are more advanced in their ability to integrate with standard nascent tools that we use today, like electronic health records. And so as people look at their mobile application strategy or their patient collaboration strategies, it's important to think about the maturity of these technologies and how they can integrate into your existing environment. So if we look at the next slide, just thinking about the opportunities that do exist to improve collaboration through portals. And there's still a lot of ground to make up here, especially in the U.S. So EY did market research in 2014 that did indicate that our patient portal usage is still lagging, although there is great interest in patient education, and is a very high priority over the next 3 years as providers strive to engage with their patients in a more meaningful way. But what we found is that 35% of our respondents, and these were actually the top 100 users of information technology in the U.S. And what we found was that 35% of those report that internet sites to support wellness and disease management are being used. They use applications to support disease management. Although they're being used, they rank the lowest among current health information technology initiatives and infrastructure at 30%. So a little bit of a conflict there. And 58% currently offer patient education through telemedicine and mobile health applications, but 74% say they want to offer within the next 3 years. And there is probably some room to use some more standardized tools in terms of patient education, as most tend to be reinventing the wheel as they customize their educational platforms. So again, although people are using portals and are trying to engage patients, the uptake of those remains a little bit low. So people still trying to figure out exactly how they can engage patients and get them to use portals more often. But I think, Natasha, if you want to talk a little bit more about remote monitoring for chronic disease, that might be another opportunity for folks.
Yeah, so thanks, Bill. So if we really look at, so the patient portal is a great starting point, but if we look at other opportunity points for collaborative care and offering collaborative care as well as engaging the patient, remote monitoring is really seen as one of those opportunity points for chronic disease, which, as we know, is where we allocate 80% of healthcare resources to about 20% of our population, which is consistent if you look at many other nations as well as the U.S. So remote monitoring, if we look at what the statistics show, they show that 37% of remote monitoring tools are used and they are offered through telemedicine. And there is a total of providers that say 51% of them that they are going to be offering some sort of remote monitoring over the next 3 years. So it's seen as a huge opportunity, and many centers and many of my colleagues that I know I talk to are really exploring as how to integrate remote monitoring. How do you pick and prioritize the right patient types, and where do you start in terms of which disease states offer the biggest opportunity to integrate a remote monitoring program. 54% of respondents report that having remote monitoring or mobile devices for patient use, and many of them have found those to be effective and to have a net positive value outcome. 61% use telemedicine to provide ongoing care, and that's to avoid those penalized hospital readmissions as well as unnecessary hospitalizations for those chronic disease patients, many of them being your common diseases such as COPD, CHF, and diabetes. So the remote monitoring is really seen as a huge opportunity point as we move forward and really start to look at collaborating patient care and providing an additional layer beyond that patient portal. If we move to the next slide, the other huge opportunity point that's viewed across the care continuum are telehealth visits. And telehealth visits really are viewed to allow patients and providers to not only facilitate care, but to collaborate. If it's done across the right touch points and implemented in an effective way, it allows that provider to really keep tabs and be a partner in that patient's care. So if we look at some of the statistics, 61% of providers currently offer telemed for return patients. 42% use telemedicine for new patient visits. 40% use it for medication management therapy. And 84% of respondents use telemedicine to recommend a treatment plan or care plan. So it really allows that regular continuity of care coordination between the provider and the patient, and also can allow the patient to communicate back to the provider on a more regular basis to support ongoing care continuity. So Bill, if you could tell us a little bit about what needs to change to effectively collaborate with patients.
Sure, Natasha. So there are a host of barriers that still need to be overcome for true collaborative care models to move forward. Some of that obviously is just ingrained in care models of the past and what has historically been a paternalistic relationship between providers and patients, and moving to that more collaborative, empowered model of care where patients truly are engaged and at the hub and center of their care. And I think we continue to make strides in that regard. As we think about reimbursement models and moving towards value-based or risk-based or risk-sharing models, that also tends to start moving the needle towards more of these collaborative care models, engaging the patient with a full care team, and providing the patient with both human resources and technology resources to help manage their care, not just for themselves, but among their own family and other caregivers that they interact with on a day-to-day basis. And then lastly, from a technology standpoint, we do need to start doing a better job of integrating our technologies. And as I said earlier, looking for those technologies that are ready to integrate with existing applications in a hospital setting. But right now, what tends to exist is that you have a great proliferation of information and data through wearables, through devices, through information that's being collected on smartphones, on applications, social media, what have you, that is not currently being integrated into the more sterile data sources of electronic medical records, electronic health records, and hospital-based systems. And in fact, the great majority of information now that could be used to take care of patients exists outside of the four walls of the hospital or typical care provision environments. So we really need to think about creating platforms that allow an integrated data set that pulls in patient-supplied information as well as clinician-provided information through multiple streams and technologies, so that we can have a platform that is able to synthesize and provide views that are relevant both to the clinician community and to the patients themselves. So as people start to embark down this path, it's really no longer adequate to just think about an internal environment. And as challenging as that has been to think about internal environments and how different electronic medical records technologies speak to each other, let alone pharmacy, RAD, lab, and then you think about skilled nursing facilities or rehabilitation centers. Now we're also having to think about how we get information from outside of the hospital and the hospital system. So whether that's wearables or social media or other technologies that patients are taking to their homes, uploading information into applications, whether that's diabetic monitoring or cardiac monitoring, all of these technologies now have to be integrated and then be shared with constituents in a way that's meaningful. So thinking about how we provide a view, as I said, that's relevant to clinicians and is relevant to the particular situation, or it has contextual awareness for that clinician or health coach or nurse practitioner, and then also providing the information in a way that makes sense to patients and caregivers of those patients. So really being thoughtful about how we embed technology and how we innovate, I would say, responsibly. So making sure that there is a strategic mindset as care providers think about how they're going to integrate these technologies, not in one-off silos or one-off fashions or service line-based pilots, but rather through an enterprise holistic view as to engage patients in a deeper, more meaningful way and use technologies as a major lever toward that end. So, Natasha, maybe you can talk a little bit more about all of those challenges as we move forward.
Sure. Thank you, Bill. So there are real and existing challenges that have to be addressed in order for us to do a better job providing true collaborative care. The first, which is no surprise, is the reimbursement model. So our historic reimbursement model for healthcare has really not incented providers to coordinate care or to deliver the most efficient care, because we've been reimbursing providers still on a volume-based reimbursement system. So luckily, in these recent years, we're starting to see a shift, and in fact, in early 2015, Secretary of Health Burwell made the announcement that the value-based bundled payment percentages were going to shift from the current 20%, soon to be 30%, eventually 50%, and then in the next 5 to 10 years to 80 or 90% of overall reimbursement. So I think it's up to each and every one of us that are involved in healthcare delivery to start to manage that shift proactively and look for opportunities to incent our providers. There are many accountable care organizations. There are many centers that have a provider-payer model like we do, or truly consider themselves an integrated delivery and finance system. And so it's in our best interest to look at how we better coordinate care, manage populations, and make sure that the patient satisfaction ratings continue to be very high and that those patients stay engaged if we want to continue to be the choice provider for consumers as they start to do more and more comparisons to healthcare as they do for retail shopping. The second big challenge that we know not only applies to our industry but to every industry is security and data security, and we hear a lot about that. The good news is that HIPAA established very clear standards through the security and privacy rules, and that there are resources that are available to organizations, both through HIMSS as well as through the ONC hightech.gov site, HHS, Health and Human Services, as well as many experts in this field, to ensure that as we roll out collaborative care models, that the security is front and center. Interoperability is a huge challenge that is not only a challenge to collaborative care, but across all of healthcare as EMR adoption has grown, but the ability for EHR platforms to really share and exchange information, which was the vision, is a little bit slower to be resolved. The normalization of data is extremely important, and basic data elements should be available to providers as that patient is touched across the care continuum in order for us to really maximize the quality of care and make sure that we provide the most efficient, high-quality care and lower that what's occurring now, duplication of testing and labs, and put patients through unnecessary both procedures and expenses. There's also complexity around the technology solutions. The technology solutions aren't always necessarily contained within the four walls of a hospital, and they have to actually integrate across that patient's care continuum. As we said earlier on in the presentation, most of a patient's or consumer's overall health and well-being occurs at home. So if there are wearables that patient chooses to use that allow them to be more motivated and engaged in their health care, we should be able to integrate that into the overall information that's shared and captured across the care continuum. And then the final challenge is the adoption. So if we look at how current workflows exist across the care continuum, they really haven't been designed to facilitate the use of both the technologies and the apps that are available today to help us deliver a collaborative care model. We really have to look at workflow redesign, but ensuring that the workflow is not more challenging for the providers or more cumbersome on those patients if it's truly going to be adopted and become part of the regular mainstream of healthcare delivery. And I think really that is the best way to summarize all of the challenges. So I think we've done a good job of representing and highlighting the opportunities, why collaborative care is so important, and what the challenges are that many providers and systems will come across. And while those challenges are real. I think every one of them is able to be overcome. And if you look at them in a stepwise approach, they're manageable. So I think with that, Bill, we could probably pull together some of the summaries of what would be most helpful to understand in terms of overall collaborative care.
Yes, thanks, Natasha. So I think what we've seen in the market are those organizations that are best able to succeed in collaborative care models are those that are able to implement tools and options for patients that are integrated into an overall information strategy and yet are intuitive to patients and based on their own preferences. We've seen organizations that can offer teaching that is appropriate on a patient-to-patient basis. We see organizations who are actively seeking to collaborate with patients across all interactions and consistently use collaborative technologies in their care plans. These organizations also maintain a human touch with technology. The technology is an enabler, not a replacement for the human interaction. And we see clients starting to acquire multi-source data and make it consumable to not only their clinicians and providers, but to the patients in appropriate ways. And finally, able to manage and display data so that it's actually usable information. And Natasha, I didn't want to know if maybe you want to talk a little bit about your own experiences in some of these areas and how your programs evolved.
Yeah, so thanks, Bill. So I think what we have been focusing on is really investing in technology that allows us to develop the new models of care that are patient-focused and allow that collaborative care approach. And so if we look at what we've done over the last decade or so with our own patient portal, it's really evolved. And it's really evolved in these last few years as we want to make sure that we deliver what consumers are expecting. And that includes not just access to their health data, but provides them with easy-to-reach educational tools. As you mentioned, I think that's a key driver. We want to be able to help patients with certain chronic diseases or that have acute illnesses be able to reference credible sources of data, allow them to be able to understand what is going on, and allow them to truly be engaged and a partner in their overall care, because we think that it'll produce better outcomes and really develop that partnership where they will view us as a healthcare partner in their overall care continuum. The ultimate vision, I think, is to really be able to use the data and analytics to be able to push the relevant education materials, reminders to patients based on what we know about where they are in their life, what's important to them. So in other words, if you have a pregnant patient, you know that they're interested in nutrition data and that they may want to know at certain points of their pregnancy key points that they should be aware of, or key nutritional factors, or things to expect, and even ways to plan to integrate that new child once it's delivered into their overall life. So I think that we're looking at it as an opportunity to integrate more tools and resources. I think the portal is the foundation. We're also really integrating online virtual care. We have a platform that's available to patients that allows them to get diagnosis and treatment within 30 minutes at their convenience, 24 hours a day, 7 days a week. We think that also does a better job of taking the pressure off of the primary care providers that can then really deal with the higher acuity conditions. And at the same time, it also decreases costs and eliminates more of that episodic care that happens if a patient ends up in the ED or in an urgent care or retail clinic. So by offering and integrating through our own platform, we're able to capture and integrate the electronic health record data and make sure that that patient's visit is summarized and captured somewhere, and we know what happened in that one occurrence. At the same time, offering a convenient, less expensive alternative. But there are so many additional options that we're working towards. Remote monitoring is one that's on our list. We've had success with it with congestive heart failure patients in the past, and we think there is tremendous opportunity to expand that across many more high-cost chronic diseases, which will help us with unnecessary readmissions or visits to the ED or to hospital admissions that are the last thing that we would want and the last place that patients want to be. The other tool, I think, where this can be integrated across the continuum is even when patients end up having to be in a skilled nursing facility home, using touch point tools and engaging the family through those tools is a huge asset, and also we're capturing the outcomes both clinically as well as in terms of patient and overall satisfaction. So I think that's probably the best way for me to summarize what our own experience has been and where we're looking at, making sure that we provide a collaborative care model that is built on top of the foundation we've established through our own patient portal over the years.
Thanks, Natasha. I think another built-in best practice that you have with your organization is the payer-provider integration. So I think another thing that we're seeing is the joint efforts of payer and provider to come together to share information, to create shared care plans to really wrap around a patient and truly have the patient at the middle of their information, in the middle of their care plan. So I think that's another thing that we see leading organizations implementing and doing very well to advance along the spectrum of collaborative care models. So thanks, Natasha, very much for sharing your experience and your strategies for the future. And with that, Wali, I'll turn it back to you.
Thank you.
Great. Well, thank you, Natasha and Bill. Appreciate the insight there. As a reminder, everybody, we'll be taking questions. I've had a couple questions pour into our feed, but continue to add your questions to the feed. Also, any questions that you have, you can tweet it out using that CDWHC handle on Twitter. So with that said, I guess I'll start off with a couple questions. Natasha, you hit on a couple of the challenges, and security seems to be one that we're getting some questions about. But before we go into some of those specifics, just from a higher level, I think one of the questions here was, do you think the portals can sometimes prevent patient understanding and collaboration? And for example, here's a scenario. If lab results are posted to their portal before the physician has time to call or explain the results to them, which could eventually lead to a possible misunderstanding and undue angst.
So maybe I'll take a shot at answering that at a more general level, and then maybe Natasha, you could share some of your specific experiences. But I think, when people are rolling out their portal strategy, this is definitely a very important consideration. And there's change management that's involved not only from the patient side, but from the physician side. And what we see organizations do oftentimes is stage the release to the portal versus the release to the clinicians. So often at the beginning of a portal release, it could be a 5 to 6 day lag between clinicians receiving information and it being posted to the portal. So there is that time to interact as necessary. There's also some decisions that need to be made that maybe sometimes there are specific lab results that would never be released to the portal until a clinician has signed off on them. That's another decision that sometimes people need to make in terms of the governance of the portal. But usually, once they start with those types of parameters, they'll then roll back so that there's less and less of a lag time between a release to clinician and release to portal. And I think the other big best practice is providing appropriate educational tools that are tied to the release of that information, so that people have at least some understanding and have links to tools that help them understand what specific test results may or may not mean. Natasha, do you want to talk maybe more about your specific experience?
Yeah, thanks, Bill. So I agree, and I think what we do is we implement that lag time. So we give our providers what we believe is a reasonable time within which to contact the patient. Now, there's always that fine balance, right, where, do you wait and give somebody weeks before you would release the lab results because that they may not be able to reach the patient. And those are all decisions that have to be made. I think we're all of the belief that lab information probably should go out. I think where it becomes a little more sensitive is maybe certain pathology or radiology reports that are released, and if the provider doesn't get a hold of the patient, it may not be because they haven't tried, but they just haven't connected. But I think that there are opportunities where if we integrate certain education and certain additional ways that information is released. I think today it's a very basic, you see the test and then you see, what the reading is, and then you'll usually see like the red arrow that's either up or down, or you've got a normal or a high, and that could cause some angst to some people. But I think if we could actually do a better job integrating more overall plain English education that is also available when we release some of that, I think that would actually, again, just empower the patient more to better understand and to not be concerned. And I think that'll be the evolution of how that information is actually presented. I think today it's very basic, but there's opportunity to improve that delivery as well. But there is that balance, as I said, and do you withhold it or do you release it? And if the patient is concerned, then they have the opportunity to message their provider immediately or to contact the office. So I think there's no easy answer, but it's a balance and it's a decision that every organization has to make.
And it's interesting, Natasha, as we move forward, and patients are becoming more empowered. I was at a conference earlier this year where I heard a speaker, was a younger woman who had idiopathic thrombocytopenic purpura, and for those listeners on the phone who may not know what that is, it's basically a lack of platelets that stops your blood from clotting. And she was obviously very active in her care, and so it was necessary for her to get the information about her platelets as soon as possible so that she could take appropriate actions in her own care to manage her disease. So you have that kind of, when you do have that true patient engagement and true collaboration where the patient is an active participant and manager of their own care, where that release of information becomes very important. And I think, not to be too provocative, but if we move forward, there in the very near future, there could be instances where patients are getting their own blood tests without clinicians. So they're going to be getting blood tests and information without any intermediaries. So I think that we're moving in this direction very quickly, both professionally and societally.
I agree.
Right. We had another question, and Bill, this goes back to one of the initial slides that you spoke about having a more engaged patient, some of the benefits there in regards to readmission, and also accuracy within their patient record. We see some improvements there. So vice versa, though, I guess the devil's advocate argument to that is in a question that says, do multiple versions of a patient record, due to the multiple, do they still exist in silos today, right? So multiple versions of patient records exist in silos today. Does that pose a problem for true portal integration?
I think it's a great question, Wally, and it's certainly one of the technology hurdles that we need to overcome. It certainly can be overcome with a robust EMPI strategy or Enterprise Master Patient Index strategy. So as we think about marrying these technologies and providing a single source of truth, master data management and Enterprise Master Patient Index capabilities as a part of that overall strategy are paramount to doing that. So is it a concern? Absolutely. Are there technologies and tools that can help us to address that concern? Absolutely. So you just have to be, again, strategic and thoughtful in the way that you start to bring other information and technologies and data feeds on board so that you're not creating duplicative reports or noise in the machine, but rather getting clean data integrated into one patient record that can be used in meaningful ways. It's a great question and a strong technology challenge, but one that can be solved.
Great. Thank you. Another question we had, security top of mind for healthcare. What can organizations do better to protect their patient portals? And vice versa, what can they do to instruct patients to do so?
Natasha, I don't know if you want to talk about some specific examples that you have. I mean, I think that generically it's just making sure that patients are aware of different security risks that they can incur by taking care of their own health through mobile technologies. Patient portals that are offered by health systems tend to be probably the most secure way that they're going to enter their own health information. I think where patients are more at risk is when they're using apps that they download themselves, not necessarily understanding the security parameters that may or may not be there with different apps. I think that, you know, outside of the portal, there's a lot of texting and unsecure emailing that goes on between patients and clinicians, and that could be addressed through some simple strategies with encryption and using certified tools to do those types of things within hospital environments. But I think, you know, you think about awareness as probably the most important thing that people can do for patients to help them from a security standpoint. Not only with patients but clinicians, understanding the need to use encryption when communicating with patients outside of the electronic medical record. And Natasha, did you have any lessons learned or anything else you wanted to share specific to your organization?
Yeah, so what I think I would share is, you know, we're all always at risk. I just met actually this week a gentleman who is involved in the making of the Snowden film, and you know, he calls himself the ethical hacker, and he's out and he does consulting, and he basically can demonstrate how easy it is to infiltrate many different computers and IP addresses. So the reality is, I think that we, as a society, have keenly become aware, and I think reminding patients that they're at risk is very important. What we as a health system do is put in all kinds of firewalls and policies and procedures in place, and make sure that our providers know that, you know, they can't use FaceTime, they're not using Skype to have an audio-video synchronous true medical communication or render diagnosis and treatment with the patient, that the platforms that we integrate are all HIPAA secure and certified, that as we integrate technology, whether it's remote monitoring or other tools, I think you talked a little bit, Bill, about the FDA, you know, approval process for many of those, including many of the mobile carts that are used now for telehealth. And so you try to take all the precautions. Is it 100% secure? No, I don't think that anything's 100% secure. But I think, you know, that we all have an obligation to make sure that everything we do roll out, we do it very conscientiously, and we integrate and use the highest level of security possible. And sometimes I think where it makes it cumbersome is when we've done that, we've actually added layers of password protection in that may be frustrating for consumers, and I could see that as being potentially a turnoff, but I think that's where it's going to be very important for us to educate consumers of why those things are in place, why we may have them have to log back in if they walk away after a few minutes. Those types of things, I think we just have to keep reinforcing and reiterating. But the biggest risk is what consumers do every day when they're posting on Facebook, or they're commenting on things, or they're Twittering or Snapchatting. I think that, you know, people forget that there's a lot of ways that they can compromise their own security, and that they probably do on a daily basis.
Great. I think we have time for one more question. I know big focus here was around some collaborative best practices through patient portals and through, you know, the touch with the patients. Bill, you highlighted that was going to be the focus kind of in that initial slide. But we're getting some questions that all kind of revolve around utilizing some of these tools and the impact internally within an organization between clinicians, whether it's for morale boosting, whether it's for workflow improvements. So I guess I'll summarize a couple of questions, Natasha, and turn to you. Did you predict any? Did you focus on any improvements in those regards as you were looking at some of these tools and some of the initiatives to improve the interaction between clinician and patient? And were there any that kind of arose that you didn't necessarily anticipate but were glad to see as a result of your overall efforts?
So is the question about, how we thought about integrating the different collaborative tools into the current workflow for the providers?
Yes.
Yeah, so we have been extremely mindful of that, and that's because we recognize that the providers are already overburdened and everybody is being forced to do more with less. And the last thing that we wanted is to roll out a system that would be more cumbersome or add to that burden. So when we roll out most of our projects and programs, we have the clinical thought leaders that are involved in mapping out workflows before we actually implement. And so we kind of manage through how is this going to look for our provider as the end user, and have them be at the table. Some of the things that we did with our telemed visits is making sure that all of the scheduling and the registration and the overall documentation is captured through the same mechanism that they're currently using, whether it's on the inpatient or the outpatient side, and so that they're not having to duplicate work and again, spend additional time. We also look at, how do you integrate maybe other levels of care providers. So if you're looking at care coordination, where can the case manager intervene, and where can the MA or the nurse intervene. And so again, being very mindful that when it comes to the clinicians, they have a very limited time. It's already overburdened, but wanting to make sure that the processes are maintained as much as consistent as they are in their workflow today, because a lot of that workflow really can't change for them. There's all these pressures with meaningful use and utilizing the EHR and making sure that, we're hitting all the targets that they need to meet stage 2 and soon to be stage 3. So I hope that answers the question, but yeah, I think that when we roll out, and I think it's an important thing to remember, that you do look at that and you try to integrate the overall process to make it as seamless as possible. Even if there are some tweaks, there may be ways where you can offset by using some other individual or intervention that takes away some of the burden to make it overall a little bit less cumbersome.
Great. Well, thank you very much. I think we're just coming on 2 o'clock, so I wanted to, again, thank Natasha and Bill for your time today. Thank you for all of our attendees for joining. And thank you again to our sponsor, CDW, Cisco, and Ernst & Young. I hope that everybody found this as a productive and worthwhile conversation. And you can view this recording on CDW's Commune IT website. Additionally, we have some contact information on the slide if anybody has any further follow-up. With that, we'll wrap up. Again, thank you everyone for the time. Enjoy the day.